Today, we're going to be doing a presentation about posture and specifically how it can affect running. But in addition to that, how it can affect other aspects of our overall quality of life. We're going to talk about a few different things, but primarily we're going to talk about the benefits of a balanced posture. A little bit about me first. My name is Dr. Whit Voss. I'm a chiropractor in Alameda, California, called Alameda Chiropractic and Ergonomics. And primary thing we do is we help parents, professionals transform their journey so that they can be more present, patient, and passionate with an elevated quality of life. And we do that through comprehensive exams and patient-specific care plans. I am a certified ergonomic assessment specialist, which means I have taken extra training to do ergonomic assessments and planning. I'm also certified in the selective functional movement assessment, which is a movement assessment that identifies dysfunctional movement areas, which might be contributing to a painful area that someone is having. So for example, low back pain, but in actuality, the person has a problem with their hip. What we're going to be talking about today is posture. So what is posture? What are the mechanics of posture? And why is your posture important? We're not going to be talking about pain. Pain and posture have a complicated relationship, and that is definitely something that I could probably get on a soapbox and talk about for hours on end. But today we're actually not going to be talking about pain at all. We're also not going to be referencing perfect posture because perfect posture literally does not exist. What we do know is that certain postures use less energy than other postures do, perhaps, but there is no such thing as a perfect posture. It's actually not something I talk a lot about with my patients unless their posture is actually something that is a contributor to their pain issue. And we have ways of kind of figuring that out for them. So what is posture? Posture is how we hold our body in three-dimensional space. How you stand, how you're sitting, how you're moving. This is all posture, whether static or active. What I do refer to with my patients is something called upright or balanced posture. So if you look at this little guy here, he kind of looks like a little bit of a straight line. So when we talk about an upright, balanced posture, this is what we're talking about. We're talking about somebody whose head is above their shoulders, their chest is up, their shoulders are back, their shoulders are above their hips, and their hips, if they're standing, are above their feet. The reason it's a balanced posture is because we are more equally activating the muscles in the back as well as the muscles in the front. And as far as holding our body upright, this has been shown to be the type of posture that uses the least amount of energy for us simply because of that balance that's happening. So the question to you, friends, how often do you think about your posture? How often are you checking your posture? Are you someone who thinks about it often, or are you someone who only thinks about it when you start to feel stiff and uncomfortable? Are you a person who sits more like the person on the screen, or are you somebody who sits more in an upright posture? Are you someone who leans? What does your posture look like? Are you someone who prefers to stand maybe while you're working? Why would that actually be important? The reason that's important is because form follows function. So how we hold our body the majority of the time is going to affect how we're able to hold our body at other times. When we sit in a more static posture, when we're holding our body in one certain way for long periods of time, that is going to affect how our muscles are going to be able to activate, and it's going to affect joint mobility. If you don't use it, you lose it, right? If we're not using our upright posture muscles, the ones in the back especially, then those muscles are not going to be as active as the ones in the front. And they're also not going to have as much endurance as well, which is going to affect how you're able to run later on in your day or earlier in your day whenever you're doing your running. Posture is a mindful practice. When we're at work, we want to be thinking about how we're holding our body, think about how we are changing how we're holding our body throughout the day. When we come home, maybe we're driving home, when we get home, then we're thinking about how are we using our body at home? Do we come home, kick off the shoes, sit on the couch, watch some TV? Do we do gaming for 2 or 3 hours? How are we using our body there? About 60% of our day, for the most part, in that more flexed forward posture. So how much are we switching that up throughout the day? And how we're using our body at work, how we're using our body in our leisure time is going to build the foundation for how we're able to use our body while we're running. As far as one of the biggest things when we're running, especially, is respiration. What we do know is that when the head comes forward, we have a change in how muscles are able to activate while we're breathing. When the head comes forward, we're mostly using the muscles of the neck and the upper body to get that breathing done rather than the diaphragm, which is our primary breathing muscle. And that's going to be something I'm going to talk about a little bit later as well. With a slouched posture, we do also notice that we're not able to activate the diaphragm as effectively. So if we are sitting in a slouched posture throughout the day, we're not using our diaphragm and we're not expanding our diaphragm as effectively as it can, which means that that muscle, because diaphragm is a muscle, is not being used in as efficient of a way as it could throughout our day, which means when we go to run later on, let's say in the evening, then that muscle is already having changes in how our brain is able to activate it. So we're not going to be able to activate it as effectively as we could if we were to regularly have a more upright posture. So for runners, and we can see how the activation of the muscles, especially in the neck, pectoral muscles, muscles on the inside part of the ribs, the diaphragm, all these muscles working together to be able to lift the ribs and enable our lungs to expand as much as they possibly can. Muscles that attach to the back, muscles that attach to the shoulder blades. So the shoulder blades come forward. How is the activation of those muscles going to change? So that's something that we want to think about as we're working throughout our day and also as we're running as well, because I've noticed this. I've just recently gotten into 5Ks and I notice it pretty consistently, especially toward the end of the race. People, as they're getting tired, tend to have their head kind of come forward, shoulders kind of round. So not only are they tired, but they're also decreasing their ability to effectively breathe. So that kind of just piles on top of each other. When it comes to posture, there's some really interesting connections between that and psychological health, as well as our ability to regulate our stress response. It's very common. It's actually one of the things that if somebody goes into a therapist, that the therapist is looking for is, does this person have a more forward slouch posture? Because people who deal with depression tend to have that more forward flexed posture. So the question I want to ask you is, why do you run? So a lot of people get into running and get into exercise generally because we have so much data that says if you exercise regularly, it will have a net positive effect on your overall mood. And that is, for me, definitely something that I enjoy about exercise. As someone who has dealt with chronic depression for pretty much my entire life, being able to exercise effectively and often is something that helps me to manage my symptoms of depression and maintain a more neutral state of mind. And that's something to think about when we are going throughout our day. If you are someone who has dealt with depression or you are someone who might presently be dealing with depression, it is effective to have a more upright posture as far as the symptoms of depression goes. Why was that? They don't really know. They said it might be a little bit of mindfulness. It might affect how hormones or neurotransmitters are created in our body. We do know that a forward slump posture can affect digestion. A large amount of serotonin is made in our gut, so that might have something to do with it. What we do know is we have multiple studies where someone changes their posture to a more upright one, that it has a positive effect on how their brain is actually perceiving the world around them. And when it comes to stress, this is something I was referencing before, when we are activating chest breathing is more related to the fight or flight response. Whereas diaphragmatic breathing or breathing from the belly is more in line with the rest, digest, parasympathetic response of the nervous system. So when we are feeling stressed, we're slumped forward, head comes forward. Now we're using all of our chest breathing. So now we're stressed and we're actually creating a physical response back to our brain that we are definitely stressed. So it's this feedback loop that happens that doesn't help us regulate our stress better. Whereas when we go into that upright posture, we allow the belly to be able to expand, to do diaphragmatic breathing, and that's how we can decrease the stress feelings that we are having, especially throughout the day. So for many people, and I've seen this in a number of patients, where they have this almost permanent forward slouch with that head forward. And for them, it can be difficult to actually get into that upright posture. And that's something that when I was young, I dealt with a lot. I used to ride horses. And the main thing my coach would yell at me almost all the time was sit up straight, sit up straight, sit up straight, hold the reins more upright, all of these things. And what they didn't understand was it was actually physically painful for me to sit upright. So what are things that can actually make it difficult for people? Well, one, we might have difficult with spinal mobility or shoulder mobility. So in order to be upright, we have to be able to extend through the mid back and have more extended neck as well. If we are not physically able to do that, it can be difficult to get in that upright posture comfortably. And if we're trying to help with that person's posture so they can have that more upright posture, it's going to potentially be more difficult for them. And we want to try to make it as easy as possible for them to get into that upright posture. If somebody has decreased core stability, that's going to affect their ability to maintain that upright posture as well. And if we have a lot of foremuscular imbalance, so the front muscles are very, very tight and the back muscles are very, very loose, we're going to have an actual physical restriction of those muscles in front to bring those shoulders back and sit in that more upright position. So there's lots of different things that can combine to make that upright posture more difficult for people. If it's more difficult to have that upright posture, they're just going to default to that more flexed head forward posture. So for anyone who is wanting to have a positive effect on their posture, they want to make it easier and more natural for them to sit in that more upright posture. We have to figure out why they're not able to do that. Is it a psychological health thing? Is it a potential pain issue? Is it that we just don't have that range of motion and we need to work with them to get that range of motion back? What is it? So we need to have a comprehensive movement-based assessment, and then we have to have a specific care plan for them to follow so that we're addressing their issues and not just giving them, go to YouTube and look up posture and do those ones, because those may be ones that they need, but they may need other ones as well, or completely different ones altogether. As I mentioned, the thing we think about is for that upright balance posture, head above shoulders, shoulders above hips. If we're standing, hips above feet. So with that, one of the biggest things for my patients is the shoulders that have come forward and are almost kind of stuck that way. So the first thing I ask them to do is imagine that they are taking their shoulder blades and they're tucking them into the opposite back pocket. So what that does is that automatically brings those shoulder blades back and down a little bit. Then we can start to kind of play with the head, bring the head back over the shoulders, and then making sure the chest is up. So extending a little bit in the mid back. And then when we're standing, that can be a little bit more difficult because everyone has their own neurologically set center of gravity. So when we are working with someone about posture, I have them stand there and we look, where are we leaning forward a little bit? Are we leaning back a little bit? And then figuring out why we're doing that, and then giving exercises for them to be able to more accurately and adequately kind of check themselves. One of the things that we do with the SFMA is ask people what it feels like in their body. So instead of saying, okay, it should feel like XYZ, what does this feel like to you? If you were to think of one thing in your body that's changed, what would that thing be? And then you have them be able to connect that themselves so that when they are doing those exercises themselves at home, they can self-correct a lot more easily. The biggest thing for people I've seen is bringing the shoulder blades back and imagining tucking them a little bit into the back pockets on the opposite sides. That's usually where we start with people. And then from there, we kind of set everything else around that area. The shoulder blades are what's coming back and we're tucking down. So if we're having difficulty with that, then we need to improve the muscular activation and endurance of those muscles specifically that are attaching the shoulder blades to the body. I generally give people the YTL exercise. So they're usually on the ground, put a hand towel underneath the forehead, and you're on the ground. You're not moving your physical body at all, but you just bring the shoulder blades together. So there's the Y, you bring it up like this. There's the T, you bring it up like this. And then there's the L, where you're bringing it up like that. As far as throughout the day, if somebody's having difficulty maintaining it, that's okay. Because guess what? We're not supposed to have the same posture all day. Like, we're not supposed to be sitting static for long periods of time. Generally speaking, about every 15-ish minutes, changing it up, but maybe setting a alert on their phone or on their watch, something that just reminds them to check their posture every so often. So we work little by little on the different pieces. And again, We don't have perfect posture. I cannot stand that because people think perfect. It's like, okay, we want you to be physically comfortable. Don't worry about making it perfect. Don't worry about making it all the time. Just do your best to remember to check yourself throughout the day.
I'm a physical therapist, so I deal with this all day long. Another thing that I've heard too that's been helpful is without overthinking, is just bring your head as if there's a rope on your head, just pulling you up. So
Mm.
up, things kind of fall in place a little bit.
Generally speaking, things that hold our body together are things that will lead to our muscles and our brain not activating the muscles that do the same thing. So if you're going to wear it, do it for a short amount of time, half an hour every hour or something to that effect. If someone is going to buy one of those and they haven't bought it yet, I'll generally tell them you can just buy, like TheraBand, but like the really, really thin TheraBand. I like them as a reminder, but I don't like them as something that forces you back. Because when it forces you back, it gets really uncomfortable and you're not necessarily activating the muscles that we want to be activating to make that a comfortable position for you. There's definitely times and places for them, but as something to do the job for you, I don't generally think that that's a fantastic idea.